Welcome to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is a podcast where we connect you, the listener, to what really matters the most in rural health. So today I'm thrilled to be in the studio with a very special guest, introduced to me by another very special guest that we've had on the podcast before, Barry James Mathis III, great friend of mine and mentor, someone who we've had on this podcast before, sent me an email and said, I've got an incredible recommendation for you. And it's Ann Odom.
That's correct.
And Ann Odom is with us from PYA, same company Barry works with and at. And Ann is a principal. But, you know, the thing that really struck me is I read through the introduction that Barry sent, and it was pretty incredible because you've got quite a background in leadership. And, you know, when he recommends someone, and I know we do tease Barry a lot, as we should, but when he introduces you to someone, it's usually because he has full faith and confidence. And when he started sharing details, I first asked, can I hire her? And he said, nope, you can't hire her. She works for us. I'm like, okay, well, then I'll interview her at least. And what we like to do here is spend a little time talking about your industry that you're in. And really some historical perspective is the work that you've done over your years in leadership. And what the focus is as a podcast is, how do we save rural hospitals in this country? Mm-hmm. You know, and, you know, there's a lot of pillars and a lot of drivers, right? We have finance quality, people growth, and there's people that are assigned to quality and growth and people. But, you know, really at the end of the day, what we do are for patients and their families. And a lot of our industry sometimes gives up on that notion because we're always fighting the government or chasing a dollar with the insurance companies, that sometimes that doesn't always become the top priority. And when we lose our center focus for that, there's challenges for hospitals. But we're going to talk a little bit about, you know, your role at PYA, what you do, and then in a greater discussion about, you know, what can a company like PYA do for rural hospitals across this country. So great to have you in the studio today. It's a thrill to have you here. Why don't you tell us a little bit about yourself?
Well, thank you so much, JJ. I am thrilled to be here. Great that you mentioned Barry.
We have to.
Love working with him. And I have to tell you, he said so many outstanding and kind things, not only about you and your team, but about all of the great work that you do here, the great patient care that you deliver. And I really just couldn't wait to get here.
Well, this is exciting. I'm excited
very
to have
exciting.
you on the podcast today. And you know, for our listeners who are listening across the country, they don't know you. I want them to get a sense of who you are. So give us a little background, but also why don't you share a fun fact about yourself too at the end of that?
Certainly. I would be happy to. I think I'm going to start with patients, right? So we're here to talk about healthcare.
Yeah.
And I think it's important for context to know that by background, I'm a physical therapist.
Yeah.
So I got into healthcare wanting to help people, to help families, particularly in recovery. Mm-hmm. It is truly privileged presence to be part of patients' journey. Yeah. And I was afforded just so many great opportunities in healthcare over the last 3 decades. Yeah. I've had the privilege of serving as a hospital president, as the president for multiple hospitals, as well as doing service line work across an entire enterprise. Mm-hmm. I've worked in hospitals that are very large. I've worked in medium community-sized hospitals, and I've also worked in hospitals that are quite small and serve rural communities. Yeah. So I appreciate, you know, the entire gamut of that work. And the one thing in common, regardless of where you're at or what the size is that you are helping people, you're helping patients, families, and their community. That was my story for about 27 years. Yeah. And then someone like Barry comes along.
When you thought maybe life would go a different direction, right?
Yeah.
Right. So I want to ask you a question. Did you ever think about, you know what, leadership is tough. You know, Colin Powell says, you know, it's brutal, it's hellish, it's lonely. Did you ever think about, you know, after your time as a leader that you just thought, I'm just going to go back in at the bedside? Did you ever give that thought before you joined PYA?
Yeah, you know, that's a great question, because always in the back of my mind, and even while leading. And frankly, as a leader in PYA, I always look to like how to make those connections with patients and families at the bedside. So I think it's always something that is in my mind.
Right.
I think it will always be with me.
Yeah.
But yeah, certainly as a leader, I think what I love most, not only in that hospital-based or healthcare system-based leadership, but also with PYA, is how do you bring teams together on behalf of patients and families to deliver that care, right?
Yeah. So speaking of teams, it's a lot of what you do, right? So give us really a thumbnail sketch about, on a day-to-day basis, what type of work are you doing at PYA?
Yep. So when PYA invited me to join their team approximately 2 years ago, they really offered me the opportunity to work within their teams to do a variety of things. We call it performance transformation. And you might say, okay, performance transformation, that sounds a little lofty. Like, what is that, right?
Yeah.
So obviously, hospital operations is what I've been into for a long time. We think of performance transformation as where that operations, strategy, and finance kind of all intersect, because you have to think of all of those things when you're making decisions.
Sure do.
None of that happens in a silo or in a vacuum. No. So thinking about that, the kind of work that we do are things that you have to be thoughtful about bringing all of that together. Sometimes we have healthcare systems or healthcare entities that are going through an integration. Sometimes we're working with an entity that has a single problem that they want to solve. Like, hey, our emergency department is so busy that we can't respond to people quick enough, and we need to get more efficient. And what do those workflows look like? And, what can we do? And we will work those problems from like front end to back end, right? Because as you know, emergency department crowding is not uncommon today.
No, it isn't.
And you know what? That doesn't mean it's an emergency department problem, right?
No,
There's so many other factors.
Yeah.
There's so many other factors. So we'll look at that from a multifactorial point and really, help people solve problems. We are here to help. There's also a lot of times where people like you or your peers are busy. You're the responsibility you have operating a hospital and all of those associated services.
It's just overwhelming.
It's overwhelming.
Yeah,
there's gravity to it. There is just such a tremendous amount of responsibility.
Right.
And your teams are busy every single day.
They are.
And sometimes you have projects or things where you just need more bandwidth.
Right.
But you need to rely on somebody that you can say, hey, I know that person's done it before.
Yeah.
And I kind of need them to work as an extension of me, right? To help you with those kind of things. So we'll do all kinds of projects where somebody like you might have a very specific, gosh, if I could only get this done, could you come in and help me do that?
Right.
And
you
those
have a
are
tremendous
great.
bench strength at PYA. I mean, you have folks that are IT CIOs, CMOs, CEOs, CFOs. And that's what I love about the company is, I can anywhere from an integration of a computer system to operations on financial improvement. And that's really what I think the strength of your company is, that you have a very deep bench.
Yes, we
and
do.
That does help quite a bit. So what's a fun fact about you?
A fun fact is, and I was thinking about it on the drive over here, that my family has had a home in this area for the last 30 years.
Hillsdale County. Isn't that something?
Yeah.
Do you remember going to it?
Yeah. So I feel very connected, very
connected. You going to swing by there on your way home?
Of course I am.
Absolutely.
Yeah. I remember taking the long way all the way down 12 instead of
all
taking
the way down,
all the way down 12.
Instead of 94 and all of that.
Instead of 94 and all of that. Back when all of that stuff, if you remember,
communities.
It was all those small communities were just so busy and bustling.
They were.
And so
Wasn't
many
it fun?
shops and stuff. Yeah.
Movie theaters, shops.
Drive-ins, all of that.
Now some of those towns are gone.
Kind of closed.
Yeah. It's pretty sad.
Yeah. So that's a fun fact that I've spent a ton of time in this area.
Yeah. So you're like,
you're
a natural here in Hillsdale County.
Of course.
That's excellent.
Of course.
Well, today we're talking about how healthcare strategy has far-reaching impact on our patients, on systems, and ultimately on our communities. Leanne is here to share her perspective and insight as a principal at PYA. And we'll talk about patient care, federal funding, and of course, what does all of this have to do with rural health in America today? So I want to ask you the very first question. You outlined your background, which is amazing. But how does that background that you have in healthcare serve your current role when you actually land on a campus of a hospital across the country? Because you're not just Michigan-based. You're going across the country, right? And you probably love Michigan. That's where your focus wants to be. But at the end of the day, when you land on campus, tell us how your background integrates with all of that.
Yeah, and you're right. We are across the country.
Yeah.
So the last 3 weeks for me, I have been in 3 different states on 3 different hospital or health system campuses. So I'm very happy to be home
I bet.
this week.
Yeah.
I think my background, what serves me very well, is that regardless of what hospital campus I'm going to, it does feel like home.
Yeah.
Right. Like so comfortable.
Yeah.
Particular, and really the people at PYA are like that, very comfortable in the healthcare setting.
Right.
The protocols, you kind of know what to look for. It's that awareness of the environment. So it is really being at home.
Mm-hmm.
I also think, having a high degree of appreciation for what matters most to people like you, delivering that care and, being held accountable by patients and communities, which is, how do I deliver high quality? How do I do it in a way that's efficient and that is patient-centered?
Right.
So I think that my background, having served at the bedside and working with patients and families and being part of multidisciplinary teams, it's just a great fit.
Absolutely. And you get the occasional, here comes the administrators. Oh, my goodness. They're the auditors. We're in trouble. But I think, your opening statement was, we're here to help.
Yeah.
And I know that's a cliche sometimes used by the government, but you truly mean it. We are here truly to help improve systems. You're not out to take people's jobs. I remember the very first engagement I had with Barry. The IT director came in and said, "So am I done? Are you firing me?" I'm like, "Not at all. I want to build you up. I want to make sure that our systems are where they need to be. And we sometimes have to bring on outside support to be able to see it from a different lens, because we get caught up in this thing that we do every day in rural health, right? And the industry's all around us and things are changing. But if we don't, then we have a problem in how we're serving our patients. So I think the opportunity for you is that you have served in that leadership role. You know what it's like to live on a very small margin, right? In small hospitals.
Absolutely.
And that's a challenge.
And I think that's magnified in the rural setting
It is.
as well. So if you think about resource availability in rural healthcare, the ability to staff in rural healthcare, access points for patients and their families, it is all magnified when you look at it from a rural healthcare.
It is.
And we see that across the country in the rural communities that we serve.
We do. So let's talk a little bit about that then, because you have to see similarities as you're going to rural hospitals, right? I'm sure you've heard a million times, well, we don't do it that way here. Or we've
different.
Always done it that way. Or we're different because our acuity is higher, JJ. You just don't understand. We're seeing sicker patients than any other community in this world. No, we're not. But it's hard to say that. But what are the similarities that you are finding right now, current day, between hospitals in whether it's the large systems or the small rural hospitals? What are they?
I was at a really fantastic rural hospital about 700 miles away from here pretty recently. And others across the country, it is access. So how do people get appointments with providers and the right level of providers?
Right.
And I think in that vein, so they're not running to the hospital all the time,
Absolutely.
right? Because
utilizing your ER or
nobody wants to run to the emergency department. People want to get regular old doctor appointments.
Yeah, they do.
And if you find out you need subsequent treatment of some sort or testing or whatever it is, how do you keep that care close to home?
Right.
Because people do not want to drive a long time.
They don't.
People deserve to be cared for close to home.
Absolutely.
And
well, think about this, Leanne. There's also communities like ours where we have no public transportation. Close to home means a lot. And it's an important step for some patients because this is all they have.
Yeah.
So that we have to bear in mind. But go ahead.
Yeah. No, that's a great point. Also, I think in general population, we are so reliant on technology. And you get in areas that are rural, like this one, and sometimes you don't have connectivity.
No.
So everybody says, oh, we'll just do telehealth or whatever.
No,
well,
doesn't exist.
It's not that simple. If you
Absolutely
have,
not.
your areas that
Right.
just don't have connectivity.
There's none, literally. I mean,
yeah.
we have a manager here that has no cell phone service at his house.
Yeah.
None.
And that's real.
2025, in the year 2025, no connectivity.
Yeah.
But we can't rely on technology as the only mechanism in rural country like ours. You just can't do it.
Agreed.
It doesn't exist. And so you have to look at ways that you can serve the population. What my philosophy is, we go to their backyard, right, and
Exactly.
try to serve them there, which is difficult because there's no margin in that typically. You have to have a staff and prop up a building and all of those things. But as you look at some of the other similarities, right now there's a shortage of nurses and providers in this country. Are you seeing that bleed out in other places as well and impacting care?
We are. I think certainly it was widespread. COVID, immediately after COVID.
Yeah.
There seems to be pockets of improvement, but there are so many systems out there that are still struggling
We're one of
with
them.
staffing.
Yeah, we have 26 travelers here and a 40 open positions. That is the difference between, Hillsdale being profitable and not profitable is actually cutting out some of those travelers. But how do you cut the travelers out and you are going to compromise some care? So it's a very difficult thing. So we're seeing that across the country. What are you hearing about Medicaid in these communities?
Yeah, that's tough. There is just so much uncertainty right now.
There is.
Nobody
it's very scary.
It's very scary. Nobody knows what to do.
No.
So many community members are saying, am I going to have insurance? Am I not going to have insurance?
It's a real question.
It's a real question. So we're seeing a big push from healthcare systems and sites to say, we know that we have to do more with less.
Yeah.
And what does that look like?
What does that look like?
What does that look like?
Yeah.
People are really, in these conversations, we're talking about how do you leverage partnerships, particularly in rural communities where it is, how do you partner with schools? How do you partner with churches?
Economic development, the list goes on.
All
right?
of that, yeah. So that thought of, how do you come together so that everybody can work together towards a common goal is really a dominant conversation.
It is. So let's talk a little bit about that because all those challenges you just mentioned, right? You've got staffing, reimbursement, all of those challenges. Technology. Let's talk about hospital strategy as it relates to solving some of those things. Because we have executives sitting across boardroom tables every day in this country in healthcare saying, how are we going to improve the margin? What is our strategy? What is our growth? How do we leverage that to solve the problems you just identified?
Thinking about being strategic and thoughtful.
Yeah.
One thing, and you might say, hey, Leanne, that's a little contrary to what you just said about keeping people close to home. But I think one thing that communities and hospitals and health systems need to consider is everybody can't be everything to everybody, right? Like
say it all the time.
You don't need every single fancy robot or discipline or diagnostic test there is. You need to pick the top things that your community needs.
Agree.
And you need to do it well.
Really good.
You need to be the superstar at it.
Yep.
And then you need to find the right partnerships and really provide that navigation and warm handoff with other partners to create like this community of care. You can be solely independent and still have this community of care around you.
If you do it right,
exactly.
You certainly can. And that's important. We're talking about sustainability for hospitals into the future. And Scott Becker, who's been on this podcast several times, just shared with us, in fact, just a few weeks ago, that 800 plus hospitals are at risk of closing right now in this country. And if this legislation goes through with Medicaid, it's going to be a lot more are going to be at immediate risk of closure, including 20 here in Michigan that are at immediate risk of closure. But as you look at that, there's just a lot of questions around how do we become sustainable in this market. And I would have to tell you that my philosophy is you got to be patient-centered first. We lose sight of that. And I want to talk to you from your clinical perspective, and that's what's led you in your leadership role. Not all leaders get that. You understand that, right? And not all leaders get that. And I've had managers tell me, before, clinical managers, that, well, that's why nurses make the best CNOs and nurses make the best CEOs and nurses. Listen, we all can advocate for patients, right? Some of the most articulate, high advocacy folks I've ever run across have been some of my environmental services workers who connect with the patient in the room and who are making sure that they have what they need. If they hear an alarm, they're responding, right?
Absolutely.
You can't pass that room. And so I want to talk a little bit about that continuum of care, okay, for patients. Because I think if you get your patient-centered focus right, the rest falls into place. I believe that. Now, not everybody does. But at the end of the day, why don't you talk to us about, patient care, continuum of care, why it's so important, and what needs to change in the way that hospitals are currently engaging in that patient journey? What would you say is something that we need to shake up?
Yeah, well, so first and foremost, I'm going to agree with you 100% that if you get
Let's close in prayer.
Yep, okay, we got this.
We got it.
According to JJ and Leanne,
Absolutely, we got it.
If patient-centered care, person-centered care is your true north, you've got it.
Yeah.
Interesting that you talked about who makes the best CEO, right?
Right.
I think it's the best listener because if you can listen to patients and families and communities
right.
and really be thoughtful and take their feedback in, tailor your processes and your offerings accordingly, that's patient and family and person-centered care.
Yeah.
The continuum of care, so you asked, what does the continuum of care mean and why is it important?
Right.
The continuum of care looks at that journey from start to finish. And when I say start, that's thinking about health, right? Like, are we delivering health or are we delivering health care? So we have to think about things like prevention, healthy initiatives to keep people healthy. So that continuum of care is, what do people need across the entire spectrum?
Right.
And I think what happens in healthcare, sometimes people get really focused on that silo and, okay, we do a bunch of tests in this area or we do these procedures, but we got to look at it more globally. And I think in PYA, particularly in performance transformation, that's what we really try to partner with people about is how do you look at the continuum of care? Because you might have an issue or something you're trying to solve in this particular segment of care, but oftentimes the answer is way upstream and it's going to have an impact way downstream.
Absolutely.
And if you don't look at it across the continuum,
you have an issue.
You're really not addressing it.
Correct.
So for me, that's what continuum of care means, and that's really how you approach it.
Yeah, that's incredible. So let's talk a little bit about, as you go into these hospitals, in your integration, why don't you talk a little bit about that first? Because I have a follow-up question on that. So talk about, what does integration mean?
Yeah.
What does that even mean?
Yeah, you know what? That's a great, I'm glad you asked.
Yeah.
Thank you for asking,
Absolutely.
right?
It's not even part of our questions, but I just need to know.
I think traditionally people think of integration as like, oh, these two hospitals or health systems come together and you're going to bring these teams together and you're going to bring workflows together, and that's integration. And I think in a very traditional sense in the industry, as you hear about these systems getting bigger and bringing more hospitals on, like, is that integration? Yes, that's integration. And it is business integration, it is clinical integration, it is physician practice integration, it's IT integrate, it's all of that, right? So yes, you can do integration with all of that. I like to think of integration as a concept that applies to a lot, like you can do integration work within your single hospital. If you are getting a new computer system or a new record system, you will have workflows that change. What you fundamentally do at the bedside will change. And how do you integrate your teams so that their workflows align with that new system, right? That's not a big, like, two hospitals coming together. That is integration done internally in your own backyard, right? And how do you manage that? Because the concept, I think, is still very much the same. So you're going to look at current state, but more importantly, you're going to say, what's my vision, what's my goal, and what do we want to achieve? And then we do that gap analysis in between to get you there. And that gap analysis in between and coming up with that plan to get you to the vision usually involves integrating multiple systems, multiple teams.
It does.
To get you there on behalf of the patient, right? You can't lose track of the patient.
Absolutely.
there are systems that we see that might have multiple sites, and they're all kind of doing their own thing. Gosh, talk about redundancy, inefficient.
Right.
And you and I just got done talking about how do you do more with less.
Yeah.
If you're doing all this redundant stuff or inefficient stuff,
certainly no synergies there.
no
And,
synergies there. And at the end of the day, it costs more.
Yep.
You're not providing value.
No. Patients can get confused if they're going to the same system,
Yeah.
but at different intervals and interactions with the same system that looks different.
Yeah.
That's a problem.
And usually when you do things differently and wildly differently and you're not standard,
Right.
quality can suffer.
Yeah.
Right? You get good at things by doing it, identifying what's the best way to do it, and you stay the course and you do it that way. That's when you see quality go up.
Right. I'm going to ask you one more question as a follow-up. So that's kind of the macro of what you do in integration. Talk to me about micro. You just have an engagement with one hospital. How do you, when you talk about integration, it's more than just integrating, like you've indicated, two systems together. Talk to us on the micro. If you were to come in as PYA, what are you looking for? What types of things in terms of synergies or process flow are you specifically focused on to have a better outcome?
Yeah. So, you use words like efficiency. I think following that patient path throughput is one of the big things that we're looking for, because that throughput, start to finish, can really tell you a lot about efficiency.
Sure can.
Tells you a lot about pain points. And that tells you where your opportunities are.
Yeah.
We also spend a lot of time looking at the infrastructure. So people sometimes forget, you're so caught up in what are these patient care workflows that you forget about, like, what is supporting all of that? Like, if you think about I think I'll just call out lab, because I love lab people. It's a great, it's a fascinating service. If you're running specimens all over the place and you don't have like a real strong processes and how you're collecting and moving specimens and then how they're getting reported out, that adds so much time to that workflow.
Absolutely.
So we really look at those infrastructure pieces, those supporting pieces to say, how is that impacting your overall workflows? And that's where we also try to, have that value add, if you will.
So if you had a proud moment where you, in the last 2 years, you said, you know what, we cleaned that up, or we did X, Y, and Z, anything that comes to the top of mind, like of where you're just like geeked about it, you're excited?
Yeah, actually. And I'm smiling about it. Yeah.
Beaming.
I'm going to bring you back to teams and like being that leader because love that. And I'm so passionate about it. But we were working with a healthcare system, and they had 3 sites that were doing 3 dramatically different things with their hospitalist program. And you know how important hospitalists can be to really,
absolutely,
drive the ship. Well, a person is there for that inpatient stay.
Yes.
And PYA was at the table not only to serve as subject matter expert and to guide the system on efficient hospitalist functioning, but we also really served as the leader to bring these 3 teams together.
Great.
And it was that leadership. We had 3 medical directors that weren't really talking to each other. And to be able
significant problem.
Yeah, and to be able to bring them together to say, how do we talk about, okay, what are you all doing today, but really what should you be doing? And for them to then have that conversation around, here's our best practice. And that it turned into such a collegial and collaborative environment that didn't exist when we got started, that project wrapped up with 3 teams that came together to say, wow, this is the right thing to do for the patient. And we're all going to do it the same way.
And that, it feels great, doesn't it?
Yeah. Not because
the patient gets served better. The patient gets served better.
Yeah.
They do. No one's fighting over who has to take the patient.
Nope.
Which is what I have faced here before in our environment before the current group. But we had separate groups in the ER, hospitalist, outpatient, and everyone was almost fighting who had to take the patient. We had to change our mentality that we're working together to make sure that patient gets the best care at every stop and every interval. So let's transition real quick. Let's talk about one of the reasons I would assume that hospital executives are calling you in is because the margins today in healthcare are very thin, if at all existing.
If there's a margin, right?
A lot of hospitals are underwater right now. It's going to intensify with some things that are happening in Washington. But the main concern, of course, being financial performance. But through efficiencies, through process improvement, it can be from purchasing to just workflows, right? We can improve the bottom line in a hospital system. But I want to ask you, you're traveling across the country, you're seeing these hospitals struggle. What are your thoughts on all what's going on in this country right now with some of this legislation that will inevitably close these places? What can we do as a community, as people in leadership roles, can we do to advocate for patients?
Yeah. A couple things come to mind immediately. And I think the two top of mind for me is we do get focused on the margin and the dollar and the workflow and the efficiency that sometimes we get distracted.
We do.
With that.
I agree.
And we do forget about the patient.
We do. I agree.
There's a lot of organizations we see that are so focused on that margin that there's an opportunity to double down on quality, because we know that oftentimes you're leaving a lot of money on the table if you're not focused on quality, right? So I would subject that to you that, focus on quality and everything else falls in line. The finances will follow. Yeah. So that in these uncertain times, that is one thing. Don't get distracted.
Right.
Double down on quality.
Right.
I think the other thing that really jumps to the top of my mind is community, and particularly in rural areas where you are so dependent on those other community partners that I talked about, whether it's churches or, the local municipality or like whatever it is, right? Schools, is your community best. And it's that local, like health. When people say healthcare gets local quick,
we know it.
It does. You know it.
Grocery stores,
churches.
Know it.
Yep.
Absolutely.
And you know best what advocacy efforts your community needs. Yeah. And what you can do is encourage people to join that advocacy movement. So, I often think of like patient advisory councils and, as a great way for hospital leaders to listen to their community.
Right.
It's when you have groups like that and you're listening carefully, there's also a two-way dialogue that happens there. And that can often really get communities energized around how do we advocate for ourselves and how do we create the movement for ourselves.
Yeah, which will also create a movement to sustain your hospital.
It will.
Drive utilization and also become advocates and champions of the hospital. Because right now, that's what we need. We need our community rising up to say, these cuts are harmful that are going to happen.
Yep.
And we know these cuts are going to happen. There's no way around it. So at the end of the day, as we're facing these challenges, what advice would you give as a former CEO, right? Take your PYA hat off right now. Former CEO, and then, having lived through some of that yourself, and then as a consultant that can help us through these challenging times. Is there hope? So give us both. Is there hope?
There's hope.
Okay.
I am always hopeful. I do think it comes down to looking at what you do and why you do it, meaning your programmatic portfolio. Like, what does the community need and what do we want to do well and stay the course with that.
Absolutely.
And be fiscally responsible doing it.
You have to.
And high quality.
Yeah.
I would shed the things that don't make sense.
And it's hard, right? In small communities, to say you need to divest programs that have been there for a long time, that employ maybe the lady you go to church with.
Exactly.
It's tough.
There are some
but those are decisions.
Yeah, there's sacred cows out there for certain reasons.
But some may have to be sacrificed.
Well, and that's where I think it's how do you listen to the those community advisory boards or whatever you call it, right?
Yeah, like PFAC. You name
get the dialogue going, create the trust, and everybody should share in that common vision. People will then understand the why.
Yeah.
Because you know what? Do we want to give up a couple of things versus just not be here, right? Like, what's the alternative?
Right, absolutely.
And then I think people need to get real about that.
Hospital dries up, and now your nearest hospital's an hour and a half away.
You got it.
Is that what happens? No, we have to band together. Great advice. And we're going to get a piece of advice in just a minute. But before we do it, my goodness, it's almost been an hour. They tell me I get 20 minutes for these.
Yeah.
We may have to break this into a couple segments. They're all mad at me. But at the end of the day, I want to bring it back to PYA, okay? Because that is... for us as a hospital, it was a game changer in improving processes, workflow, and it did create efficiencies where our bottom line was impacted positively from this. So I would say, from your perspective, who's the ideal candidate to reach out to a PYA representative to say we need help? What's that hospital look like?
I think that hospital or health system, if you're wondering, hey, I wonder about this, or I could use help with something, we have a culture of help. We are solutions oriented.
Very much so.
And we're radically responsive. That's kind of
Absolutely.
one of our cultural things.
Yeah.
So while you are responsive to patients, we want to be responsive to you because we understand who you're serving.
Right.
So I would say anybody that has a problem to solve, and you've already talked about the variety
From
of
quality to finance to patient-centered
variety
to
of
IT,
yes.
you got it all.
We have all of those things,
Yeah.
compliance, audit. We have nurses on our teams. We have physicians that we partner with if you need certain physician leadership. We are there.
Yeah.
And again, I cannot overemphasize our help culture.
Right. And I would agree with you, and I would second that and say from a personal testimony that your value added as a company is incredible to organizations like Hillsdale Hospital. So thank you for what you and your company have done for us. Thank you for being here today. It's very important to let our listeners across the country know that the leadership that you have demonstrated in your hospitals that you've led as president and CEO to the work that you're doing now, that there's hope for rural hospitals in this country. We don't have to close. That there's hope, that where that hope exists, we can just ignite a fire inside the people that live in that community. And for our hospital, we're 110 years old here very soon. It's pretty incredible.
I saw that
we've been here for 110 years. I want to be here another 110, and it's getting tougher to do that. But companies like PYA can help you and your strategic direction. So thanks for joining us today, Leanne. One of the things that we do before we break is that we always ask our guests to give a rural health recommendation. And what I mean by that is we like to post these for inspiring young up-and-coming leaders. Like, from your background, your experience, what piece of advice, sage or otherwise, would you give for a hospital executive to survive and thrive in today's market? What advice would you give them? Is it, run and cry to the hills? What is it that you'd give to us? And then we're going to add that to our online, and then we'd like to play that back to our listeners. So what's your rural health recommendation?
My rural health recommendation for today, and thinking about all the dialogue we've had, is I would like to leave with the thought of partnership, meaning you do not have to do everything by yourself.
Right.
You do not have to solve problems by yourself.
Right.
There are so many great resources out there. It's not up to you to do it independently. We are stronger together, and you're stronger by making smart and thoughtful partnerships, and all boats rise when people work together.
Absolutely.
And, brings it around to that sense of community.
Yeah. I often say here, we're, yes, an independent hospital, but we're interdependent. I count on partnerships with other major tertiary centers, but it doesn't mean that I have to have an acquisition or a merger with that place. Independence is still important to a lot of rural hospitals, but you can gain that independence by being interdependent upon other systems that are friends of yours.
Absolutely.
And friends are hospitals that give you your patient back after you refer them to them for specialty or, select care. And then you holistically can take care of that patient as a system, right? Like, they come to Hillsdale.
It's your network.
It's your network.
It's your village.
It is.
Right? They always say it takes a village.
Yeah.
It's a great example. It takes a village.
Right there it is, ladies and gentlemen. Lynn Ann said it the best. And the village of Hillsdale is going very strong. And throughout this country, we would encourage your community hospitals. If you need help, there is help available for you right here today. By tuning in, we'll put some comments in the show notes with some contact information for PYA. If you want to reach out to them, you can. And I want to thank especially you, Leanne, for being part of this today. And for Barry, you're listening. I know you are, because you're going to compare the notes to when you were here. But thank you, Barry, for giving the recommendation. We do appreciate it. This is the best PY interview I've ever had, so I'm going to leave it there. And we hope to catch you on our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.